Hello dear students and friends, welcome to Sri Ganesh video lecture. So after a long time again I have come back after a long break. So this is a very important topic I am going to deal with today. So that is a congenital heart disease. In pediatric, that is a congenital heart disease. So congenital heart disease consists of acyanotic congenital heart disease and cyanotic congenital heart disease. So acyanotic congenital heart disease consists of atrial septal defect, ventricular septal defect, patent ductus arteriosus, which is shortly known as PDA, patent ductus arteriosus. And next one is cyanotic heart disease. There is a tetralogy of Palo, TOF, transposition of great arteries, and tricuspid atresia. So these are the classification of congenital heart disease based upon the cyanotic and acyanotic. Okay. So when you call acyanotic congenital heart disease, when the pulmonary blood flow is not affected and the oxygenation of blood is also not affected and does not, the congenital heart disease which does not lead to sinuses are those known as cyanotic heart disease. Okay, cyanotic heart disease, cyanotic congenital heart disease are those where the pulmonary blood flow is decreased and gas exchange function is affected and resulting in cyanosis. Okay, so this is the difference between cyanotic and acyanotic congenital heart disease. So let's start with the atrial septal defect right now. Okay, so let's begin with the atrial septal defect. Atrial septal defect, which is known as ASD. Okay, so first one is the definition. Atrial septal defect is a abnormal communication between the right atrium and left atrium. Okay, so this is the heart. Okay, so this is known as atrial septum. It is known as atrial septum, and this one is a ventricular septum. This is ventricular septum, and this is the atrial septum. Whenever there is an opening at the atria, okay, and if there is abnormal communication between the right atrium and left atrium, this condition is known as atrial septal defect, and there is a shunting of blood, or there is a movement of blood from left atrium to the right atrium. Why there is a movement of blood from left atrium to the right atrium? It is because the pressure and volume in the left atrium is greater than that of the right atrium. So that is the reason why there is a shunting of blood from left atrium to the right atrium. So this condition is known as atrial septal defect. Okay. So atrial septal defect is a congenital heart disease characterized by abnormal communication between the right atrium and left atrium and resulting in shunting of blood or movement of blood from left atrium to the right atrium. Okay. Next one is, what are the etiological factors? Etiological factors. So etiological factors, first of all, the cause is unknown. Okay, it is known as idiopathic. Okay, so the exact cause of atrial septal defect is unknown, which is known as idiopathy. Okay, and what are the other factors which are associated with atrial septal defect is genetic factors and chromosomal abnormality. Genetic factor and chromosomal abnormality. Okay, so this atrial septal defect is most commonly associated with the chromosomal abnormality like a Down syndrome, Turner syndrome, Klinefelter syndrome. Okay, so whenever there is a chromosomal abnormality, so those chromosomal abnormality conditions are associated with a congenital heart disease such as atrial septal defect. Okay, next one is maternal insulin dependent diabetes mellitus. Okay, so maternal insulin dependent diabetes mellitus. If mother suffer from insulin dependent diabetes mellitus, so there is a chance of a development of fetus with a congenital heart disease such as ASD. Okay. Next one is birth asphyxia. Birth asphyxia. Okay. So in the case of difficult labor, when there is no proper supply of oxygen during the delivery of the baby, okay, through the birth canal, so at that time, so there is a chance of development of congenital heart diseases. Okay. And next one is fetal hypoxia. Okay. Fetal hypoxia, that is decreased oxygen concentration in the fetal blood. Okay. Apart from that, if mother consumes alcohol during the pregnancy, so that may also contributing factor for. Okay, so alcoholism during pregnancy. So alcoholism during pregnancy can also result into atrial septal defect. Okay, so now let us see what are the types of atrial septal defects. Types of atrial septal defect. Okay, first is ostium secundum. So when we call ostium secundum, when the abnormal communication, that is a defect is present, depending upon the location of defect, three classifications have been made. See, so when you call ostium secundum atrial septal defect, when the defect is present exactly at the middle of the interatrial septum. Okay, so when the opening is present at the middle of the interatrial septum, it is known as ostium secundum. Okay, next one is ostium primum. Ostium primum. So ostium primum, when you can call it as a ostium primum, when the defect or the opening is that is present on the lower border of the interatrial septum. Okay, so then we can call it as a ostium primum. Okay, next one is one more is there, that is sinus venous ASD. Sinus venous. So when we call it sinus venous ASD, that is when the defect is present at the top of the interatrial septum. Okay, when the defect is present at the top of interatrial septum, it is called as a sinus venous ASD, atrial septal defect. Okay, so when the opening is present at the middle of the interatrial septum, it is called as the ostium secundum atrial septal defect. When the defect is present at the lower part of the interatrial septum. Okay, so lower part, it is called as the ostium primum atrial septal defect, and when it is when the defect is, or the opening is present at the top of the interatrial septum, so that is called as a sinus venous ASD. Okay, now let us see the pathophysiology. So what happens here, due to etiological factors, there is a development of congenital defect, that is a atrial septal defect. Okay, and what happens here when there is a atrial septal defect? Okay, atrial septal defect, it may be ostium primum secundum or a sinus venous congenital heart disease. So due to etiological factors, there is a development of structural deformity defect, that is a atrial septal defect, and because of this there is a shunting of blood. Okay, shunting of blood from left atrium to right atrium. Okay, because the pressure in the left atrium is greater than that of a right atrium. So because of this there is a shunting of blood from left atrium to the right atrium. Okay, so because of this the pressure and volume in right atrium increases, because there is a already the blood is present in the right atrium, that is by superior vena cava and inferior vena cava carrying the deoxygenated blood to the right atrium. So already the volume and pressure is there, but in addition to this there is a shunting of blood from left atrium to the right atrium. So because of this there is more pressure and volume in the right atrium. Okay, then what happens here, more amount of blood will goes to the right ventricle. Okay, so because of this what happens here, there is more amount of blood goes to the right ventricle. So increased blood flow to right ventricle, and there is a increase blood flow to the increase blood flow to lungs. Okay, So there is more blood is coming from left atrium to the right atrium, and more amount of blood is going to the right ventricle. Okay, and more amount of blood is going to from right ventricle to the pulmonary artery. So because of this, there will be more pressure on the pulmonary artery. The pressure on the pulmonary artery increases. So the pressure on pulmonary artery increases, and this is known as pulmonary hypertension. Pulmonary hypertension. So what happens here? There is a sending of blood from left atrium to the right ventricle. So because of this, pressure and volume in the right atrium increases. So because of this, what happens here? More amount of blood goes from right atrium to the right ventricle. And what happens here? There is increased blood flow from right atrium to the right ventricle and increased blood flow to the lungs, because on contraction of right ventricle, there is more amount of blood is emptied into the pulmonary artery and more amount of blood flow go to the lungs. Okay, and the pressure on the pulmonary artery also increases, so that causes pulmonary hypertension. Okay, so when there is a more blood flow to the pulmonary artery, what happens here? The pulmonary artery capillary pressure increases. Okay, increases. See what happens here? When there is more amount of blood go from right ventricle to the lungs, so what happens here? Here there is a alveoli, okay, and these are the pulmonary artery capillary. Pulmonary artery capillary are the branches of pulmonary arteries. So there is more blood coming to the pulmonary artery capillaries. So as there is more pressure, what happens here? The fluid will start leaking or diffusing into the alveoli and alveolar structures. Okay, so the pulmonary artery capillary pressure increases, leading to diffusion of fluid into alveoli and alveolar space. So this condition is called pulmonary edema. It is called as a pulmonary edema. And because of pulmonary edema, there is a chance of recurrent respiratory tract infection. Okay, so this is the pathophysiology of atrial septal defect. This is one-sided pathophysiology. Okay, so because of increased pulmonary blood flow, pulmonary artery capillary pressure increases, and because of pulmonary artery capillary pressure increases, there will be forcing of fluid or diffusion of fluid from the pulmonary artery capillary into the alveoli and alveolar structures, into the alveoli and alveolar structures. So there is a congestion of fluid, there is accumulation of fluid in the alveoli and alveolar space. That condition is known as pulmonary edema, and pulmonary edema condition will cause recurrent respiratory tract infection. Okay, so this is one-sided pathophysiology of atrial septal defect. Now see what is another side pathophysiology of atrial septal defect. Okay, so here is a heart. So there is a defect here. Okay, that is a congenital heart disease. This is the right atrium, right ventricle, left atrium, left ventricle. Okay, so due to etiological factors, what happens here? There is a structural defect. Okay, structural defect. So this structural defect is called as atrial septal defect. So because of atrial septal defect, there is a shunting of blood from left atrium to right atrium. So there is a shunting of blood from left atrium to the right atrium. Okay, so because of shunting of blood from left atrium to the right atrium, there is decreased volume of blood coming to the heart, left ventricle. Okay, decrease blood flow to left ventricle. Okay, and because of decreased blood volume in the left ventricle, so there will be decreased stroke volume, decreased cardiac output, and decreased peripheral tissue perfusion. So because of this decreased peripheral tissue perfusion, there will be growth retardation or failure to thrive. Okay, So because of decreased peripheral tissue perfusion, decreased peripheral tissue perfusion, there is a what you call growth retardation, or we can call it as a failure to thrive. So what happens here in the second phase of physiology? Because of there is a shunting, because of etiological factor, there is a structural defect that is known as atrial septal defect, and there is shunting of blood from left atrium to the right atrium. And because of shunting of blood from left atrium to the right atrium, there is a decreased amount of blood flows from left atrium to the left ventricle. And on contraction of left ventricle, there is decreased blood flow to the peripheral tissue perfusion. Okay, so overall the cardiac output and stroke volume decreases, and peripheral tissue perfusion also decreases. So because of this, there is a growth retardation. There is no proper growth of the child. Okay, that is known as failure to thrive. Okay, the child will not achieve optimum height and weight. Okay, as the child grows, there is no proper or optimum achievement of a height and weight. Okay, that is known as failure to thrive. Okay, so this is the pathophysiology of atrial septal defect.